Well, probably the most important thing that I look for in a candidate is attitude. And I'm going to put knowledge of the dental anatomy and the instruments on the lowest part of the totem pole. I think that I've had several externs come to my office, and I've been teaching dental assistants for almost 30 years now. And I can look around the audience whenever I'm doing a lecture for dental assistants, and I can just tell the ones that are going to make it in the practice of dentistry. They have self-confidence. They have the desire to learn and the desire to grasp every bit of knowledge that there is to grasp. Because when I go to work, I want to make sure that I have everything on the shelf that possibly can be there to be able to take care of my patients. And when my dental assistants, when I look at a dental assistant, if she's not willing to learn, if she just wants to be there and, thinks she's just one of the team members, she's a vital part of the team. In fact, the dental assistant is the person that runs the office. The dental assistant is more important than a hygienist is as far as knowing how the office runs. The hygienist has a very limited amount of scope on what they have. Dental assistants, they have a whole lot more knowledge of where things are, how the patients come in and out, how long they take. So if I was going to hire somebody, the attitude is their first quality or the first thing I'm looking for. Most important thing they could possibly do is to shadow as much as possible. My daughter was she's now a veterinarian, but one of the questions, I was at her interview, I can't believe they let the parents in, but the interviewer told my daughter, she goes, I see you have like a whole bunch of hours as shadowing. And so she was exposed to a lot of things, and I think that's the key, to be able to not just have the knowledge that the Institute gives you, but it's also the experience of being around dentistry. Because, some things happen in my office that, even my seasoned dental assistants who I've had for one of them 30 years, she's not seen everything. And whenever something comes in that's very odd, it's because, it's a teaching situation. So I think probably the most important thing that a dental assistant could possibly do would be to get exposure to as much dentistry as she possibly can, not just in office, but also, there's tons of stuff online. You can get online and look at operations and get familiarized with any kind of possibly oddball situation. Just the other day, we had a lady that had osteomyelitis of the mandible, and that's very rare. And she has, almost no symphysis. Her lower jaw is pretty much gone. And that's the first patient in my whole life I've ever had like that. And my assistants were like, their jaws dropped open when they saw the panoramic x-ray. And I was like, oh, what is that? And that's something you don't see. But again, exposure to things you would not normally be exposed to, even in a book or in practice. You just need to stick around a dental office as much as possible prior to and even afterwards. And sometimes you learn on the job without getting paid too. So, but I love to have dental assistants come in and get them exposed to the crazy things that happen in the dental office. That's a very good question, and I get asked that whenever I do my seminars up in when I did them up in Erie. I think probably the most important thing on that is whenever I had people come to work with me, I think that they don't realize that they need to become part of the team. There's always a pecking order. There's always a hierarchy of knowledge in the dental office, but they need to be they need to know that they're part of the team. Like, I think their best bet is to learn that they have to be an integral part of the whole picture, not just that's your job, but pick up where somebody, hey, those instruments in that room need to be sterilized. The hygienist needs to have a couple x-rays taken. Be forthcoming on not just what your job duties are, but also to create some camaraderie in the office. I can't stress how many times I've done this with my team. And also, whenever I go to teach these courses, we sit around and we say, let's do some role playing. Let's do practice between, let's say, what a patient would say to you and what you would say to the patient and what the dentist would say. For example, there's decay left on the inside of number 30, and she can see it better than I can. I'm ready to fill the tooth and restore the tooth. I say to her, how do you tell the dentist that, there's still decay left in the tooth? You don't say, hey, you missed that guy. You have to learn how to, be able to help the patient's care without making anybody else feel bad. That's a very good question. And we have I'm going to give you another answer to another question you haven't asked yet. And that is how to put up with things that aren't comfortable. And I think the capability of a dental assistant to cope with the COVID thing is that, just the other day, Brandy was working on a patient. She didn't have her helmet on, face shield. I said, can we stop before we start? And get Dawn some face shield and some other stuff that she didn't have on, hairnet. And so I think that they're going to have to get used to having all this additional paraphernalia. And to be honest with you, I think it's going to probably be something I might want to keep because I think we all, dentists and dental hygienists, it's been a proven fact that we're more subjected to infection because of our proximity to the patient and aerosols and so forth. So I think that the added amount of PPE is going to be, it's hotter in the rooms. In my office, I'm going to tell you, my hygienists and my assistants are top-notch sterilizers. They do not want anything close to touching the patient. And that's going to be an uncomfortable thing for dental assistants because they're used to, maybe not really seeing dentistry from the patient's aspect or from the dental aspect versus being a patient. So I really want my assistants and my hygienists and anybody that works for me to be, really up on the latest as far as sterilization and keeping things for the patient. That patient's my sister and my brother in the chair. That's the way we always treat patients. And I want that to be instilled in the people that work for me. And if your school and other schools like you can instill that into the dental assistants and the people you graduate, that patient is you or your sister or your mother in the chair. Things are going to be sterilized. Things are going to be, dental care is going to improve. That's why I do this. Is I try to realize that, you only live in this world for a certain period of time. If I can leave dentistry better than when I got here, then that's what I want to do. And your dental assistant, to me, is, vital in that respect. Goes along with my picture. I am going to say this, that I think that the people that are the most successful dentists and dental assistants that I know are complete, true dental geeks. We think, love, breathe dentistry. We think about it all the time. When somebody's at a party and they say, hey, I got this tooth I want to tell you about, and they joke about it, like, well, tell me about it. I want to talk about it. The most successful dentists that I know think about it all the time. They communicate with other dental professionals all the time. We're on a group called the Dental Nexus Group, and there's dentists on there, there's pharmacists, there's all different kinds of people, and we talk dentistry all the time. And I think if you're going to immerse yourself in this profession, you're going to need to make sure that you really love what you're doing. Because I can't wait to go to work tomorrow. This is my day off. I feel guilty because I should be there. And dental assistants have the wonderful ability to not have to work on weekends so much and not work on holidays. They work on Sundays. They may not get paid as much as a nurse would get paid, but it's not a cushy job by any means. You work hard for your money, as we all do in this profession. But I think it's a wonderful way to get somebody that's in pain or somebody that has, a smile they're not proud of to become, within a few weeks or even a few days or even a few minutes, happy. And that's what dental assistants and dentistry in general does, is make people happy. And that's why I love what I do. And I hope that I can instill that in your assistants too.